types of cancers it protects from, and there are some recent changes to the guidelines in the vaccinations. So if you could please share with us.
Well, this is an easier topic for me. So the HPV vaccine, and there's only one in the U.S. that's marketed right now, not because the others aren't good, but because this one's probably the best, protects against 9 different subtypes of HPV. And there are hundreds of different types, but we know that only a few cause cancer.
Sure.
So there's probably somewhere in the range of 15 to 20 that are really cancer causing, but if you look at the ones that cause it, 2 in particular cause almost all the HPV related cancers, and we call them HPV 16 and HPV 18. HPV 6 and 11 cause genital warts and potentially mouth warts, and they also cause something called juvenile recurrent respiratory papillomatosis, which is obtained through the birth canal. It happens on the vocal cords, and it's recurrent papules that happen in infants, and they can have up to 11 surgeries during their lifetime to resect these because it can affect their airway. The cancers that HPV prevent is cervix, and using the HPV-9, it should prevent up to 85 to 90% of all cervix cancers. Anal cancer is almost always caused by HPV-16, so 90% of anal cancers. Vulvar cancer, about 50-60% of them. There are some other causes. Vaginal cancer, penile cancer. And then the one that is actually outnumbering all other HPV cancers at this point is oral pharyngeal cancer. And I always say it's the wrong side of the body for me, so I had to kind of research it a little bit, but it's kind of right in here. And there's a lot of structures in there, but the 2 that are related to HPV cancers are your tonsils and the back of your tongue. And the people who get those cancers are usually 55-year-old men, although women can get it as well. We're not really sure why men get it more, but we think it has something to do with some natural immunity that women may have that helps them clear it from their mouth better. People who are immunosuppressed are at more risk, but the average person that gets these or is not immunosuppressed, usually, we usually describe them as higher socioeconomic status, Caucasian 55-year-old men. And we don't know why, except that we can think of it like this. Cervix cancer is definitely HPV related, and though we have a screening test for it. So if everybody got screened the way they were supposed to, and they got their vaccine, we might be, we are aiming to eliminate it. There is no screening test for this. You can test for HPV in your mouth, but we don't know what that means. Probably 5 to 15% of the population has HPV in their mouth at any one time. And so we don't know what to do with that information. There is no FDA-approved test for that. And so it's not associated with socioeconomic status. This is because lack of insurance is associated with that. So 70% of the area of the cancers in here are caused by HPV. We think that almost, and now tonsillar and back of the tongue, it's most of them. And it's an epidemic. We're seeing it rise by 3 to 5% per year in the United States, and it is, at this point, more oropharyngeal cancers than cervix, but remembering that about 70% of those are what's related to HPV, probably about even. By 2020, it'll be the most common.
And for just from what I read, for our international audience as well, that cervical cancer, there are like 500,000 cases a year worldwide. That is huge.
Yes. Yep, and 25% of them come from India, and definitely South America and Africa, because there's rural areas and less access to pap smears. So vaccination would be great. We have 4,000 minimum, 4,000 deaths per year in the U.S. related to cervix cancer alone. We expect that if we were able to vaccinate and do the screening where we have it, we would probably be able to prevent 28 to 30,000 deaths in the U.S. alone. Probably for cervix, it's somewhere around 250,000 deaths, and so there's just it's actually 5% of the world's cancer population with just the vaccine. So who is it supposed to get it?
Yeah, and so on that note, we have survivors that are listening in that are also young moms, and they have children, like teenagers or between 9 and 26. So tell us about...
Let me stress, you do not have to have intercourse to get HPV. You can get it through kissing. It's in the mouth. You can get it through digital touching. You can get it through oral sex, and you can get it through intercourse, and you do not have to have anal intercourse to get anal cancer because everything down there has HPV on it. And so who should get vaccinated? It is a prevention-only vaccine. You want to give it before they've been exposed. And so who is that? I mean, I have a 12-year-old and a 21-year-old. You definitely want to catch them before they get intimate in any way with anyone. And so you want to give it to them when they're in the 9, 10, 11, 12 range.
Right.
Not saying that your kid's going to be active after that, but this is prevention only. And let's say they get it through kissing or touching or exploring. The other thing I like to say is if you guys can control what your kids do, please also can you write something on the Facebook notes and tell me how to do that, because I definitely can't affect what my kid does. I know I can't affect what my kids' partners do, and you can only hope that your kid will have an intimate relationship with somebody at some point in their life. They may actually have their high school sweetheart, and they've been together only with each other, never kissed anyone else. And then when they turn 30, something happens, widowed or divorced or something, and they're going back out. Protect them now. It does not work well when you get later. So again, when do you get it? 11 and 12. When you get your Tdap and your meninge, that's when you want to give it. Now, the FDA, the American College of Immunization Practice recommends that we give it to all 11, 12-year-olds when they get their other vaccines. If they get it before they turn 15, they only need 2 shots, unless they're HIV positive, but 2 shots. Even if you get it on the day before your 15th birthday, you only need 2 shots, 6 months apart. If you're 15 or older, you need 3 shots, or if you're immunosuppressed for any reason, rheumatoid arthritis, chronic steroids, transplant, HIV, anything like that. The FDA on October 5th approved it based on efficacy and safety up to the age of 45, because there's data that it can help, not as good, but can also work to prevent cervical and anal dysplasia in women and men up to age 45. In February, the ACIP will take that information, knowing that it's safe and efficacious, and kind of say, is it worth our funding? Will we prevent a lot more cancers by vaccinating from 26 to 45? Is it worth it for us to pay for that? Because once ACIP recommends it, it becomes covered by your insurance company. There are some insurances who are covering it now, but yours may not. So one, do it when you're supposed to.
Right.
Anything after 11, 12 is starting to be late. If you're 13, 14, 15, you're late. And you as a doctor and you as a parent didn't do everything, in my opinion, did not do everything you needed to do to protect your kids.
And I'll share my personal experience, because one thing is also very important, that it's not if you have a girl only, right? It's also for the boys
to protect
themselves. So
themselves.
I have 2 boys, and my older, as soon as he turned 11 for his the shot appointment, I took him and I made sure that he had all the 2 shots, and it's just like any other shot, right? I mean, so there was no side effect, there was no nothing, and it was just, and I didn't
it
even
hurts
honestly,
a little, you get a little red.
just like any other immunization.
And if you're
that
really worked
taken,
up,
right?
you might faint. So
well, they made him lie down for 15 minutes. Yeah, that's what
adolescents have fainted after
vaccines.
vaccines.
Totally fine. But the thing is, the point that I want to stress is, like you said, early is better, because you don't have to explain that much to your children.
You shouldn't be explaining anything. There should be no discussion. You're getting 3 vaccines to prevent disease later in life.
And there are no side effects. It's just like any other immunization, and that it can protect you from 9 different types of cancer.
There's extensive studies on the safety of the HPV vaccine.